Good afternoon, Chris Hemsworth. Let's begin the warm-up session. Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice are on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There's also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship. That is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello, Mihiraa. Please have a seat. I'm Chris, and I'm here to talk about Emily's discharge. I know it's a lot to take in, but rest assured she's recovering well, and we've already taken care of the dressing for her wound. She's doing really great, and the wound looks very stable. We just need to go over a few things before she goes home. Do you have any concerns at all about her care once you get home?
Hello, Chris. Thank you. I am worried about a few things. She's been a little teary, and I'm concerned about how much pain she might be in, especially after the anesthesia wears off. I also want to make sure I know how to take care of the wound properly so it heals well and doesn't get infected.
Those are very valid concerns, Mihiraa, and it's completely normal for you to feel that way. I'm here to help you feel confident about managing her care. Now, let's talk about some of the temporary after effects she might experience and how to manage them. It's important to know that a little bit of mild pain, swelling, and even some itching around the wound are all very common. For pain relief, you can use over-the-counter painkillers like paracetamol. The dose is based on her weight, so please be sure to check the instructions carefully, and remember, it's very important not to give her an overdose.
That's good to know. And what about the wound itself? How am I supposed to take care of her dressing at home? I'm afraid I'll mess it up.
I know how worrying it can be when your child has a wound, and it's completely natural to want clear guidance to ensure Emily heals as quickly and comfortably as possible. Mihiraa, let's walk through the care plan together so you feel confident and prepared. For the first day or two, the most important goal is to protect the body's natural healing process that has already started. This means we need to keep the wound and its dressing perfectly clean and dry for the first 24 to 48 hours. This initial period is crucial for allowing the wound to seal itself and preventing any bacteria from getting in, which could lead to an infection. Please avoid letting the wound get wet during this time, so sponge baths are a great alternative to showers or baths. After this initial 48-hour period, you can begin gentle cleaning. Once or twice a day, especially if the dressing becomes soiled, you can carefully clean the area with mild soap and lukewarm water, gently rinsing away any drainage. Pat the surrounding skin dry very gently with a clean, soft towel. Avoid rubbing the wound itself. To protect it during bathing afterward, a waterproof dressing or a protective film barrier is highly recommended to keep the area completely sealed from water and soap. When Emily is outdoors, it's very important to protect the healing skin from direct sunlight, as new skin is very sensitive and can burn easily and may also darken permanently. Keeping it covered with a bandage or clothing is the best approach. As it continues to heal, you might notice some itching, which is a normal sign of recovery, but encouraging Emily not to scratch or pick at the scab will prevent scarring and allow for the best possible outcome. Your calm and careful attention will make all the difference in her healing journey.
Okay, that makes sense. I can do that. And what about when she's playing? She's very active, and I'm worried she'll accidentally hurt herself again. How long should she rest?
That's a great question, Mihiraa. I first want to acknowledge how unsettling it can be to see your child hurt and to be tasked with their recovery. The goal now is to create a calm and supportive environment for her body to do its incredible natural work of healing, and that will involve a gentle home recovery period. To allow the wound to close properly and strongly, it's very important that Emily avoids any strenuous activity or rough play for the next week to 2 weeks. This means pausing on activities like sports, climbing on playground equipment, or any games that could put a strain on the wound area and cause it to reopen. We can think of this as a short period of rest that will pay off with a much smoother and faster healing process in the long run. Keeping her occupied with calm activities like reading, drawing, or watching a movie can be a big help during this time. Our other main focus is to diligently protect the wound from infection. The simplest and most powerful way to do this is through impeccable hand hygiene. Please ensure that everyone, especially Emily herself, washes their hands thoroughly with soap and water before touching the wound or changing the dressing. It's also crucial to keep the wound completely dry and away from bodies of water. This means avoiding baths, swimming pools, lakes, or any water games for at least 2 weeks, or until the skin is fully sealed and healed. Moist environments can harbor bacteria and significantly increase the risk of infection. Mihiraa, do you have any other concerns or questions?
2 weeks is a long time for her to sit still. Do I need to bring her back to have the stitches removed?
That brings me to the next point about postoperative care. Emily's wound has dissolvable stitches, which is a wonderful benefit because they will naturally disappear on their own within about 2 weeks, so you won't need to come back to the clinic just for their removal. We've also applied a dressing to protect the wound, and that will need to be removed in about 8 to 10 days. You can have your family doctor take a look at it then and remove the dressing for you. Most of the time, the recovery is quite straightforward, but it's important for me to tell you what to watch out for, just to be on the safe side. While some mild pain and redness are expected, please call your doctor or come back to the hospital immediately if Emily develops a high fever or if the pain becomes intense and isn't relieved by the paracetamol we discussed. You should also look for signs of a possible infection. These would include spreading redness that gets bigger, any pus or thick fluid coming from the wound, or a foul odor. Catching these symptoms early is the best way to ensure her full and quick recovery. You are her best advocate, and if anything feels wrong to you, please do not hesitate to seek medical help.
Dissolvable stitches. That's a relief. I'll make sure to watch out for those symptoms. Thank you so much for all this information. It's a lot to remember.
It is a lot, so let me just quickly summarize everything we've discussed. Mihiraa, we've confirmed that Emily is ready for discharge. She might experience some mild pain and swelling, which can be managed with paracetamol, taking care not to overdose. You'll need to keep the wound clean and dry for the first 2 days, and after that, you can gently wash it with soap and water. She needs to avoid strenuous activity and rough play for 1 to 2 weeks, and you should make sure she avoids swimming or water games to prevent infection. The stitches are dissolvable and will be gone in 2 weeks, but you should have a doctor remove the dressing in 8 to 10 days. Finally, if you notice a fever, intense pain, or any signs of infection, you need to seek medical help right away. Do you have any other questions, or do you feel comfortable with the plan?
No, that all seems clear now. Thank you for making it so easy to understand.
You're very welcome. Take good care, and I wish you both a smooth recovery.